Welcome to Learning Thursdays. I'm Dean Hale with the OASAS Learning and Development Unit and your host for today's presentation. Today's presentation is titled Phase 1 Employment 101, a guide for professionals to help people gain employment. And joining me today is Lisa Brown, Assistant Director of the New York Employment Services System. But first, a word about Learning Thursdays. Learning Thursdays are offered to behavioral health professionals as a free learning opportunity with the goal of improving the knowledge and skills of the New York State substance use disorder workforce as we strive to improve the lives of individuals needing prevention, treatment, recovery, and harm reduction services. A goal of Learning Thursdays is to support the professional development of the treatment, prevention, recovery, and harm reduction workforce. We do this by offering regular presentations that are relevant to today's substance use disorder treatment professional. As always, if there are any questions, comments, or suggestions, please feel free to contact us at the Learning Thursdays mailbox. You can use the same mailbox to express an interest in providing a future Learning Thursdays program. And now it's time to start the presentation and welcome Lisa.
Thank you, Dean. It's great to be here. Today what we're going to be talking about is employment. We're going to start with the New York Employment Services System, which is where I work, and what it is and how we can help you. We're also going to talk about employment considerations. OASAS specifically, how to start employment conversations with individuals that you serve. We also want to cover employment myths and facts, and just in general, employment, what you need to know. So NICE, the New York Employment Services System, is a statewide partnership, a collaborative employment services case management system. We are also one of the largest ticket-to-work administrative employment networks in the country and a primary employment services data source. But our primary focus is being able to be a resource for all things related to employment. And please feel free to reach out. We are available for your employment-related questions. When we think about employment considerations, there are lots of things that come to mind. So employment is an important role for individuals of all ages on multiple levels, individually, systemically, and also societally, as they progress toward becoming financially independent, no matter where they are in their treatment. Employment can look very different for each individual and should be considered on an individual basis. For individuals who have had no prior work history, maybe they've had a spotty work history and difficulty getting and maintaining a job, and also transitioning from school to work, and there are many other variations in between. Individuals may talk to any staff member about employment challenges, so it requires that all staff who support employment and/or educational goals have a basic understanding of the system and the languages that are being used. Individuals will likely talk about their experiences and ask questions and share their goals. The path may be bumpy as individuals transition to employment, and support will be needed from everyone on the team. This training is being provided to help all OASAS staff have a better understanding of how to respond to individuals who request employment services. The next step is talking about employment and how do you do that? How do you get that started? One of the things that comes up is when should we begin that employment conversation? And one of the things to remember is that all members of the team should be having these conversations with individuals. And these conversations can begin as early as when the individual first expresses an interest in employment, and as a regular introduction to employment as a topic. And the conversation is not dependent on the individual being ready. Even when individuals need acute management of symptoms, employment conversations are still appropriate. For example, individuals can be homeless or experiencing symptoms, and they still are able to obtain and maintain employment. To get these conversations started, when someone first enters your program, staff should be asking, What would you like to work on? What goals do you have for yourself? What are your interests? Have you ever thought about going to work? And if you have worked before, what did you like about working? Another question is, are you interested in working or exploring your options? When we get started with these conversations, it's important to discuss the overall benefits of working and focus on the path to individual, financial, and self-sufficiency. We want to provide basic information about working while receiving public benefits, provide employment resources for individuals, provide concrete examples of success, and ask what success means to them. You also want to discuss the individual's goals, dreams, and plans. When we talk about success, it can look very different for every individual. So it could be from getting a job part-time or full-time, maintaining the job that they currently have. It could include going to school, from obtaining a high school diploma or GED all the way through graduate school. It could also include working while maintaining all Social Security benefits, or it could include working off of Social Security benefits. Individuals may need basic information about what going to work will mean for them. If someone has never had a job before, they may need to know about the appropriate language to use in a workplace. They may need information about dress codes, from the entry-level type of position all the way up through professional dress. They might need to know how to work with a supervisor effectively, or specific workplace norms. In addition, talking about relationships with coworkers is a really important topic, and general office rules, and developing a work ethic. So these are a variety of topics that could come up in your conversations. All team members should be able to have these employment conversations with an individual, and the employment conversations must also include basic information about the team and the supports that an individual can be expected to receive regarding both supported education and supported employment. If an individual wants to pursue employment, the individual and the staff person can always contact NICE to receive employment resource information. Some of these resources might include a certified benefits advisor who can talk to the individual about how working will impact their benefits. And it might include an employment provider, someone who can help that person navigate getting a job. The other thing that comes up during these employment conversations are specific myths about going to work. And we want to talk about what the facts are instead. So in today's society, it takes a long time to obtain benefits, especially Social Security benefits. So individuals are sometimes really anxious about going to work with the possibility of losing them. Additionally, family and friends have heard stories about individuals going to work and losing benefits, and they're afraid to encourage an individual to pursue employment. Even if some of the SSA cash benefit is reduced or eliminated when an individual goes to work, the overall financial picture is usually much better, and a person can maintain their health care benefits in most cases, both Medicaid and Medicare coverage. A benefits advisor will be able to provide an individual with exactly how the Social Security benefits and other public benefits will be impacted by going to work. And if you need to connect an individual with a benefits advisor, please feel free to reach out to NICE and we can help connect you with one. Here are the start of some of the common myths. So one myth is I can only work 20 hours a week to keep my benefits. And as I mentioned, a benefits advisor would be really helpful to help somebody walk through how working will impact those benefits. But there are specific situations that come into play because of the variables associated with keeping SSA benefits and going to work. And it's really not all about the hours they work. It includes the number of hours, but it's also the hourly wages, the work incentives that the individual may be eligible for, and establishing an ABLE account and a PASS plan to help them keep their benefit longer. Another employment myth is I have a disability, so I can't go to work. Social Security recognizes that individuals receiving Social Security disability benefits can work, and they created the Ticket to Work program to encourage individuals toward financial self-sufficiency. And assigning their ticket to an employment provider will allow them to receive employment services to help them become employed. Another myth is I can't work until I'm considered stable by my psychiatrist. We want to avoid the disability mindset of long-term dependence on benefits, and that individuals must be considered ready or stable or even compliant in order to go to work, and that is simply not true. Individuals can work while still maintaining ongoing symptoms with adequate supports in the workplace, and an employment provider can help get those supports in place. Another myth is I have a serious mental illness, like substance use, so I cannot go to work. A person can exhibit ongoing symptoms of a serious mental illness and still obtain and maintain employment. So it's really about providing the support and encouragement and additional supports within the workplace. There's something called natural supports that can be built in on the job for that individual. And all of these can have a positive outcome regardless of the diagnosis or the symptoms a person is experiencing. Another employment myth is if I go to work, I will lose my health care benefits, Medicaid or Medicare benefits. And this is a very serious myth for people. They do not want to give up their health care benefits. They're very important. But there are ways to help an individual maintain that health care benefit. There's the 1619B option for Medicaid. There's the Medicaid buy-in for working people with disabilities. And there are Medicare options as well. So this is still a myth. You may not lose your health care benefits if you go to work. This next section, we want to talk about employment in general and what do you need to know. As you're having these employment conversations with individuals, it's important to stress the positive impact about going to work. So one of the things that comes up is a lack of employment is a key social determinant of health, as is poverty, and both lead to poor health outcomes. Low employment rates are pervasive for adults of any age, especially with behavioral health disorders, and the effects are more significant than that of their non-disabled, unemployed peers. What will improve outcomes is the weaving of employment principles and practices into day-to-day service delivery, especially by having regular employment conversations. We need to resist the tendency to leave the employment discussion for vocational-only programs. If we're providing rehabilitation supports, we must also be incorporating employment conversations. As I mentioned, employment is a good idea for everyone. It is a social determinant of health, not only financial, where they're increasing their wages, but it also impacts their physical and mental health, can help the recovery from substance use disorders. It will increase their socialization with coworkers in a new workplace, gives individuals a meaningful activity during their day, can improve their self-worth and their work ethic, and just give them an improved quality of life overall. Reductions in the need for medical and behavioral health interventions are also a positive outcome of individuals working. We have to be careful of our biases and those of others around us. We need to avoid developing a disability mindset of long-term dependence on benefits. Families sometimes struggle with employment because of the possibility of the individual losing their benefits. And an individual may want to work, but staff is waiting for stability to occur before they can support that. So it's really important to talk about those myths so that everyone is on the same page. Working while receiving public benefits is a good idea. Those providing supports do not need to be benefits experts, but they should understand a couple of basics. So individuals will have more money in their pocket and will not be penalized for working while they receive Social Security benefits, but they must report their income to Social Security every month. Individuals will be eligible for free Medicaid in almost all scenarios. The common frustration and anxiety associated with public benefits is real and need to be a part of that ongoing employment conversation. Many common myths about what happens when someone on public benefits earns wages are not real and need to be a part of that ongoing employment conversation as well. Benefits advisement resources and information must be within everyone's reach. Anyone who receives public benefits should be connected with a benefits advisor, especially because each individual situation and benefit financial picture is unique and needs to be considered on an individual basis. If you don't have a go-to person who is a certified benefits advisor, please reach out to NICE and we can connect you with someone. In addition, it's also important to have a go-to site for information about benefits. And if you don't have one, again, NICE can help, but we do have a couple of resources for you. The NICE customer resource page will give lots of information about benefits, and the Ticket to Work website, which is the official Social Security website for the Ticket to Work program. One of the other topics that comes up during our employment conversations would be, I've never worked before. What am I supposed to do? How am I supposed to act? And when we talk about that, we're developing a strong work ethic. And so a work ethic is the principle that hard work is naturally good. And we have a strong work ethic because we have learned or developed over the years good work skills, which include our behaviors, our attitudes, the motivation that we have, and the commitment to the work that we do. So work ethic is a topic that is often missed when we discuss employment and rehabilitation for people with disabilities. We forget or fail to recognize that work ethic is developed through our own families, our social or educational and early work experiences, and often without us even realizing that it's happening. Work ethic is a learned quality developed through trial and error and observation and is the result of practiced habits. Many of the core components of work ethic can be challenging, especially for individuals with substance use disorders. These are some of the typical characteristics: self-motivation, self-confidence, the ability to accept direct criticism, communicating in an appropriate way for a given environment, self-organization, planning, enduring hardship in the workplace, knowing how to navigate a work environment, and managing stressful interpersonal interactions. And if we give a minute to think about how you developed your own personal work ethic, these are some questions to think about. And as you think about these questions, think about how you can help the individual you're working with develop their work ethic. So think about how you developed yours. Who were the people in your life that modeled behavior? What does work ethic mean to you? Does the mental health system lead to the development of a healthy work ethic? Does my program? How can I incorporate these values into my day-to-day for the people that I support? Work ethic also involves the preparation for work. So thinking about how do you get ready for work? When does that start? Think of the small steps and stages it takes and our habits that we take for granted. For example, the night before, preparing us sets us up for success. So that includes clothing, food, sleep, and mentally preparing for what the day will look like. Then the morning prep routine will include transportation, navigating challenges that might derail a plan, and having backups. If there are things that come up, having a backup in place is a great idea. Here's a couple of work ethic examples. So Jesse and Sam bump into each other at the water fountain and catch up on their weekend plans. Jesse mentions that he is planning to duck out so he can get his weekend started earlier. Sam knows that Jesse didn't request the time off. So a good work ethic might be that Sam encourages Jesse to request the time off to follow the work policies. A poor work ethic might be that Sam indicates that if Jesse can get away with it, then Sam will try it too. After all, what's the worst that can happen? So that's a real-world example of what can happen as a work ethic choice that people make in the workplace. Another example is Jesse and Sam are in the kitchen preparing for lunch. Jesse shares with Sam that over the weekend he saw Ronnie, a coworker, at the grocery store, and she was with someone other than her significant other. Jesse speculates that Ronnie is having an affair. A good work ethic, Sam would shut down the gossip immediately and respond that it's not appropriate to start rumors about coworkers. But a poor work ethic would include that Sam chuckles and encourages more information about what Ronnie is doing. So some examples of good work ethics qualities include reliability and dependability, productivity, ownership and autonomy, collaboration and team support. But when we look at poor work ethics, we're including low work quality, consistent tardiness, lack of attention to detail, focusing on your own goals at the expense of the greater team or company goals, abuse or harassment, whether explicit, unconscious, microaggressions, and sabotaging of others. The next section is about the resources. So this is the final section of this presentation today. I just wanted to leave you with some resources that you may find helpful, and please feel free to reach out with any questions you might have. We have our nice website, the Ticket to Work website. There is also a Ticket to Work WISE and seminar events, which are called WISE webinars. And they are for individuals who are on Social Security benefits, but anyone can attend them, and they happen on a monthly basis and they're free. We also have included the Social Security Red Book, which is full of information about benefits. We have disability resource coordinators through the New York State Department of Labor who are certified benefits advisors, and this is the website to be able to locate someone near you. I've also included a job seeker's guide for employment, which can be helpful. Please feel free to pass that out to anyone that you're supporting. The next thing we want to talk about are benefit basics. So you don't need to know all of the details about benefits, but you should know some basic information about Social Security benefits. SSI and SSDI are separate Social Security benefit types, and they calculate wages in way different ways, but in either case, it is a good idea to work even on benefits. It's important to always consult a benefits advisor, and if you need help finding one, please contact NICE. We'd be happy to help you. To receive individual information, a benefits advisor will be able to obtain what's called a benefits planning query from Social Security to help with the planning process. Wages must be reported monthly in all scenarios, while overpayments may occur, a benefits advisor can help the individual navigate through the process. We're going to start with SSI benefits. So the SSI program provides a cash benefit payment to people who have limited income and resources. The resource limit in 2024 is $2,000 for a single individual and $3,000 for an individual with a spouse. Please keep in mind that this figure may change annually. In addition, when Social Security starts thinking about how much an individual will receive in a Social Security benefit check, they start with what's called the federal benefit rate, and that is $943. After that, Social Security takes a look at earned income and unearned income to determine how much that benefit check will be. There are specific SSI work incentives that an individual can use to maintain as much of their benefit as possible. So we'll talk about the student earned income exclusion, the impairment-related work expense, also known as an IRWI, and the blind work expense. So the student earned income exclusion allows an individual who is under the age of 22 and regularly attending school to exclude some of their work income while Social Security calculates their SSI benefits. In 2024, the amount that can be excluded is $2,290 per month, up to a yearly maximum of $9,230. So for example, an individual who is 19 years old, attending school, either part-time or full-time, and is working, again, part-time or full-time, and let's say they earn $2,290 per month or less, they can claim the student earned income exclusion for that particular month, letting Social Security know, and Social Security will have to actually approve that. So SSI will subtract their earned income from the SSI calculation, which allows an individual to keep more of their Social Security cash benefit check, up to the annual maximum of $9,230. The impairment-related work expense, or the IRWE, are costs for items or services that an individual needs in order to go to work because of their specific disability, and that these expenses are not being reimbursed by anyone else. Social Security will deduct the costs of an IRWE from the countable income when determining the individual's eligibility for Social Security benefits. An example would be a cost of medications, co-pays, and in some cases, the cost of transportation. It's really important to consult a benefits advisor for more specific information on whether or not an IRWE can be used. The blind work expense is very similar to an IRWE because it allows an individual to exclude costs for items or services that an individual needs in order to go to work. They also have to be expenses that are not being reimbursed by anyone else. However, these expenses don't have to be related to an individual's specific disability. The expenses do have to be reasonable, and Social Security's definition of reasonable is that the amount customarily charged for covered or similar services and supplies. The next step is looking at SSDI benefits, which is way different from SSI. SSA provides cash benefits to individuals who have worked and paid into the SSA insurance program, and the amount received is based on earnings. And there are several work incentives available for individuals who receive SSDI benefits and they want to go to work. There's the trial work period, the extended period of eligibility, and the expedited reinstatement. The trial work period allows an individual to test their ability to work for at least 9 months without losing their SSDI benefits. An individual will receive full SSDI cash benefits regardless of how high the earnings might be during this 9-month period, as long as the individual reports their wages and they continue to have a disabling impairment. The trial work period begins when an individual earns over what Social Security calls the trial work level, and in 2024, that level is $1,110 per month. The extended period of eligibility automatically begins the month after the trial work period ends. It is a 36-month period in which the individual will receive SSA cash benefits for all months that their earnings are below the SGA level, and they continue to have a disabling impairment. SGA stands for Substantial Gainful Activity, and in 2024, that level is $1,550 per month. Following the extended period of eligibility is the expedited reinstatement. And this is a safety net for people who successfully return to work and their SSDI cash benefits are terminated. If the Social Security cash benefit payments end because of increased earnings and within 5 years the individual's earnings fall below SGA level, that individual may be able to have their benefits started again right away through a request for EXR. One of the important things to know about the expedited reinstatement is that Social Security has 6 months to determine whether or not a person will be re-eligible for their benefit check. But during that 6-month period of time, the individual can receive their benefits while Social Security is making that determination. At the end of that period of time, if Social Security says, yes, you can have your benefit check back, then they will pick up as they left off. If Social Security says, no, we don't think you need your benefit check back, you're not entitled to it, then the individual does not have to pay back that 6 months worth of benefits they received while Social Security was making that determination. A couple of things come up when we're talking about benefits and things that are available for individuals to help them save money during this process. So there are a couple of ways to do that. One is called an Achieving a Better Life Experience, or an ABLE account, and the other is called the Plan to Achieve Self-Support, or a PASS plan. So an ABLE account is a savings program for eligible people with disabilities who have resources that would make them ineligible for other benefits. So an individual can use an ABLE account to pay for medical and living expenses in order to maintain health, independence, and quality of life. For an example, if an individual receives a $10,000 inheritance and they put that in a savings account, they are automatically over the resource limit for SSI benefits, and they will lose their SSI cash benefit. However, if they put that inheritance in an ABLE account, it will not count toward the SSI resource limit, and they won't lose their SSI benefits. A benefit for the ABLE account is you can contribute up to $18,000 annually to this account. You can have a maximum of $100,000 in an ABLE account without it impacting your SSI eligibility. So this is helpful when individuals want to save for retirement, or they have family or friends that want to put money aside for the individual for future information. The other part of this is you can use this account for a lot of different things. And right now the definition is broad enough that individuals can improve their quality of life if they need to take money out and go on a vacation, or take money out for medical procedures, or other types of information that they need for their disability. It's very helpful, and New York ABLE is the processor of these accounts. So New York ABLE would be the place that you would contact in order to get one set up. The PASS plan is called the Plan to Achieve Self-Support, and a PASS plan allows an individual to set aside money other than their SSI cash benefit for a specific time period so that they can go to work and achieve their work goals without losing their SSI cash benefit. So for example, if an individual has monthly earned income, which is not SSA, and they have a desire to go to work, and they need something in order to go to work, like a car or childcare expenses, they can set aside money in a PASS plan for that very purpose. And the plan is completed with and approved by Social Security. It is a plan that is set up for a specific time period and for a specific amount of money. If you want to set aside $50 a month for a car for 3 years, and then in 3 years the plan is over, you take the money out of the account and you purchase the vehicle. Social Security has to approve each of those plans, so it's really important to contact Social Security claim representative to talk with them about how to set one up and to make sure that yours is approved. The next topic we want to cover is health care benefits. This is another area where individuals are really nervous about going to work and losing their benefits. And so when we talk about health care, we want to consider Medicaid and Medicare benefits. So if an individual earns enough for Social Security cash benefits to stop, there are a few ways in order to continue to receive free Medicaid. There is 1619B of the Social Security Act and the Medicaid buy-in for working people with disabilities. 1619B is a special Medicaid rule that allows an individual to maintain Medicaid coverage even if earnings become too high for an SSI cash benefit. If an individual is eligible for 1619B, it will be an automatic process. Social Security will just take care of that. But they can alert Social Security by using this template letter. So there's a link to a template letter that can be completed by the beneficiary and sent to Social Security, giving them a heads up that they know that they're earning more income and their Medicaid may need to be transferred to the Medicaid 1619B process. There are some specific eligibility requirements. They have to be eligible for SSI cash benefits for at least 1 month. They would be eligible for SSI cash benefit except for their earnings. The individual must still be considered disabled. They must also meet all of the other eligibility rules, including the resource test. They need Medicaid in order to go to work, and they have gross earned income that is insufficient to replace SSI or Medicaid. Oftentimes what happens is an individual will go to work and make more money, but it's still not enough money to cover the employer's health care insurance. So this is one of those areas where Medicaid 1619B can be automatically picked up and the individual will not lose their Medicaid coverage. The next area is the Medicaid buy-in program, and this offers Medicaid coverage to people with disabilities who are working and earning more than the allowable limits for regular Medicaid and allows them the opportunity to retain their health care coverage through Medicaid. This program allows people to earn more income without the risk of losing vital health care coverage. So there are some specific eligibility requirements, and it is not an automatic process. So the individual will have to actually register and apply for benefits through the Medicaid office. To qualify for the Medicaid buy-in program for working people with disabilities, a person must be a resident of New York. They must be at least 16 years of age, and the coverage at this point is up to 65 years of age. They must have a disability as defined by the Social Security Administration. They must be engaged in paid work, and it doesn't matter if it's part-time or full-time. They must have gross income that could be as high as $68,988 for an individual or over $92,000 for a couple. And they have non-exempt resources that do not exceed the Medicaid resource limit. And that right now is $28,133 for a one-person household and $37,902 for a two-person household. There's some exciting news about the Medicaid buy-in for working people with disabilities program. Beginning January of 25, there are going to be some changes. The age limit is going to be increased so that it's not going to be limited to age 65. It can be after age 65. The asset limit is also going to be expanded to up to $300,000. You can have it assets and still maintain your Medicaid coverage. In addition, the income limit has gone skyrocketed to allow net countable income up to $27,340 per month, which is about $320,000 annually. So we want to make sure that this information gets out to people and people are aware of the terrific changes that are going to be happening in January with the Medicaid buy-in for working people with disabilities. Because it is not the automatic process, you actually have to apply for it. We would encourage you to encourage the people you support to apply for this terrific benefit. The other health care coverage that we want to talk about is Medicare. And so most individuals who receive Social Security disability insurance, that cash benefit, they are also eligible for Medicare coverage. Following the trial work period, individuals can continue to receive at least 93 months, which is 7 years and 9 months worth of Medicare coverage, including hospital insurance Part A, and that's premium free, supplemental medical insurance, which is Part B, if they've already been enrolled in it, and prescription drug coverage, which is Part D, if they've also been enrolled. After this premium-free Medicare coverage ends due to work, an individual can still buy continued Medicare coverage as long as they remain disabled. So being able to go to work and maintain health care coverage is really important. And it's very helpful that there are programs set up to help people maintain that health care coverage for as long as they can. The next thing that we want to talk about are success stories. And it's really important for people to know that when people start going to work, they get back to work and they're still receiving benefits, that there are a lot of positive things out there that can help individuals. And it can be as simple as somebody doing an entry-level job or somebody becoming a professional in a government agency or other type of office settings. So there are a lot of different types of success. It depends on what success means to a specific individual. But going to work and maintaining benefits as long as they can helps individuals become successful in life. And we want to talk about just a few of those stories. So the first person is Daniel. Daniel started his treatment as a client at the ACT team, Assertive Community Treatment. Over time, he moved into treatment with Pathways to Wellness and graduated from these services. In the summer of '22, he presented to the East New York Health Hub asking for assistance. Even though he was not eligible for the program, a quality improvement specialist listened to Daniel's concerns and provided what services he could for Daniel. Daniel was introduced to the Ticket to Work program and chose to participate. His goal is to get a second master's degree and eventually work in biotechnology in a lab, hoping to one day improve the lives of cancer patients. His own ambitions made him nervous, but he was coached every step of the way and had assistance with updating his resume and his Medicaid status. He researched master's programs, and with support, he applied and was accepted into the program. Following the successful completion of his degree, he hopes to secure an internship program within his field. So Daniel's not done yet. He's got a lot more to do, but he received a lot of support and assistance in getting him to where he's at right now. And he feels like he is a success. Amelia. Amelia her employment goal was to work as a greeter at a specific Walmart. And this was important to her because it was close to her home. And she was used to being told that she should look for other places and maybe she should wait until her symptoms were stable. But her employment specialist said that she could start talking about job goals. And the employment specialist met with the treatment team so that they were all there to support her employment decision. The employment specialist hosted a job fair and invited various companies, including Walmart, to discuss the hiring processes and any job openings that were available. Her employment specialist helped her put together a speech about the importance of having a job and why she wanted to work there. She presented her speech and talked about why she wanted that specific job. Walmart was impressed by my presentation and encouraged me to apply. The representative informed me that the greeter positions were filled, but they agreed to create a new greeter position just for me, based on my impressive advocacy during my speech. After applying, the employment specialist helped with preparing for the interview, and we discussed the pros and cons of disclosing the mental health and cognitive challenges. With the assistance of the employment specialist, I successfully got the job. Again, this is a measure of success for Amelia and the process that she went through in order to get the job that she truly wanted. Charles is another success. He says, I was not exactly sure what I wanted to do for a job. I knew I wanted one. My employment specialist spent time discussing my desired job type and work environment with me. During our time together, I still had significant mental health challenges, but my employment specialist continued to work with me anyway. My employment specialist also noticed I had very low self-esteem and hardly any support to reach my goal. The employment specialist met with my treatment team to help me develop strategies to build up my confidence, address symptoms, and identify support. Over several months, my employment specialist spent time with me and in the field connecting with businesses and focusing on job opportunities based on my preferences and engaging with employers to find a job to fit me. Eventually, the time and hard work paid off. I am working at Goodwill, working with the public and earning minimum wage. I feel better about myself and being part of the community. My employment specialist followed up after a week, and my supervisor reported that I was doing well. My symptoms have lessened and don't need as many psychiatric interventions as I did. The next success story is about John. He says, I received services from other programs in the past, but had no success in finding employment. Sometimes my mental health issues were a barrier to finding employment, but I knew I wanted a paying job. I thought my employment specialist at the PROS program could help, so I reached out to him. When I discussed my desire to find work, even though I was still dealing with my mental health issues, we started talking about work right away. He immediately asked what kind of job I wanted and began helping me identify what specific tasks I was interested in doing at work. I told him I liked what I do at my volunteer job in the PROS program, and I would like to continue to work in the food service industry and get paid for it. I wasn't looking for full-time work, so I let him know I wanted to start on a part-time basis. I also shared that I was very anxious about what might happen to my SSA benefits when I started working. He provided direct benefits counseling to me and even set up a visit to Social Security to discuss my benefits and how working would ultimately be beneficial for me. My employment specialist also helped me understand how to report my earned income and any money I receive from my public benefits to Social Security. I talked with my employment specialist about how I should share my mental health status with my potential employer. I decided I would tell them I received some support from the local PROS program and that my support system may reach out to them to learn more about the business. Once I let my employment specialist know that I was comfortable with this plan, he began talking to restaurants in the area to help learn more about what opportunities might be around for me. This was very helpful to me so I would know a little about the job when I applied, and so I felt more confident that I could do a good job there. After my employment specialist heard back from 2 employers that they had job openings, he met with me to talk about the company, location, how much pay I would receive, and what the job duties might be. I decided that I would like to apply to one of these places. My employment specialist helped me practice interview skills, and an interview was set up with the restaurant. I did great. I got the job offer a week later, and I took the job. I was very anxious about taking the bus to work because I didn't know the route and even which bus to take. My employment specialist provided travel planning and assistance to me right away. We made a practice run on the bus I was going to take, and I felt confident I could get there after that help. I let my employment specialist know that I might need help on the job sometimes. My employment specialist made me feel much better when he told me that he could provide support for as long as I needed it. I told him I really needed to check in with my employer frequently to see if I was doing well. I was nervous the first few days on my job, but after some support from my employment specialist and my employer, I felt more confident, and my anxiety and some of my mental health issues weren't as bad. My PROS team even threw me a party when I got the job. I'm so happy I'm working now for the help that I received. I've been at the restaurant for a few months and I love it. Soon I'm going to start working more hours. This is a prime example of all of the supports that an individual can receive through employment services, through the employment specialist that specializes in helping people get jobs. They can set up natural supports within the work environment and provide continued follow-along services to help that person succeed. The next individual is Marcus. I was working a nice job for the federal government for many years. I stopped working due to my psychiatric symptoms. I knew I would be able to qualify for SSDI because of my work history. So during my time out of work, I was receiving SSDI, which helped a lot. After some times, my symptoms decreased and I was able to get back to work on a part-time basis while still receiving my SSDI check. However, when I picked up extra hours during the holiday season, they cut my SSDI check, which made me nervous and confused about my financial situation. I didn't know there were rules about making extra money with my benefits, and I didn't know what to do. I spoke to my employment specialist, and he explained the rules. I had exceeded my trial work period and extended period of eligibility, which is why I lost my SSDI check when I picked up my hours. My employment specialist then explained to me that if we went down to the Social Security office and had them average my income over the time I worked, that I could get my SSDI payments back. I agreed, and it worked. I was very relieved, but still anxious that this could happen again. He and I developed a structured plan for reporting my earned income and tracking my hours worked. I was able to continue to work at the pace I was comfortable with, and by utilizing this plan, I was aware of the rules around earned income and knew that I had support when I needed it. This made me much more productive at my job and opened me up to a whole new social network through my employment. This support helped me so much. Again, this is a great example of being able to receive support, talking about benefits, a benefits advisor, and being able to explain how working will be impacting those benefits. And Tony is our last example. I always wanted to work at a home improvement store, not as a cashier or working with a lot of people, but behind the scenes, in the back, stocking and organizing things. I also did not feel comfortable telling my boss I get help for my mental health. My employment specialist told me it is okay not to tell the employer about my mental health services, and they talked with me about the pros and cons of disclosing. My employment specialist let me know that she does not have to contact employers on my behalf, and I could change my mind about that at any time. Together, me and my employment specialist began researching and applying to businesses that were close where I live and that were looking to fill positions in the back of the business, stocking merchandise. I was quickly hired for a job as a stock clerk and loved my new job. I enjoyed working with the stock team. When I first started, my employment specialist met with me every day after work, and as I became more confident in my job and working with people, she began to meet with me less often. After several months, my anxiety began to increase, and I could not sleep well, and I started to miss days at work. My boss put me on notice for missing work. I talked to my employment specialist about talking to my boss, and she was very helpful. I was given help on how to advocate for my needs and work together. We set up a meeting with him. At this meeting, my boss was so nice and shared that he also experienced mental health issues. This is really a critical point for individuals to know that support is always there. The employment specialist can jump in when help is needed. An individual does not have to disclose, but they can always change their mind and disclose a disability if they need to. This next section is about resources that we want to offer. So there's a couple of things that are important for you to know. If you're looking for information on benefits, you can go to our NICE website and the Customer Resources tab. And then we also have our locator map available on our website where you can find a NICE provider, which would be an employment specialist, and there's also ability to find a benefits advisor. In addition, there's the Ticket to Work Incentive Seminar Events, or WISE webinars. These are specifically designed for individuals who are receiving Social Security benefits, but anyone can attend. They're offered on a monthly basis and they're at no cost. In addition, I have included some information about the PASS plans and the ABLE accounts. So please feel free to check those resources out. I have also included the Job Seeker's Guide for Employment. Feel free to share that with any of the individuals that you are supporting. Thank you very much for joining me today. Again, my name is Lisa Brown, and I work for NICE, the New York Employment Services System. Thank you.
I want to thank NICE and Lisa for joining us today. I hope you all find it useful while assisting clients in need of services. Your feedback is important to us. It helps us know if we're meeting your educational goals and expectations. Once you have viewed the presentation in its entirety and completed the quiz, if prompted, please follow directions to access the SurveyMonkey website and take a moment to complete the evaluation, including suggesting any future topics for Learning Thursdays. Once again, thank you for joining us and keep up the good work.